NCLEX RN questions and answers, free PDF download for nursing students. Question 1. To alleviate dumping syndrome after gastric surgery, the client should: Option A, eat 3 large meals. Option B, drink liquids with meals. Option C, take a long walk after eating. Option D, eat a low carbohydrate diet. The correct answer is option D, eat a low carbohydrate diet. A low carbohydrate diet prevents the rapid movement of food that causes the syndrome. Small meals and lying down after eating also help. Question 2. When discussing smoking with a client who has a gastric ulcer, the nurse should advise him to: Option A, smoke filtered cigarettes. Option B, smoke cigars. Option C, smoke only right after meals. Option D, chew gum instead. The correct answer is option C, smoke only right after meals. Smoking on a full stomach minimizes the effect of nicotine on stomach acid. Question 3. External stimuli such as noise or bright lights can precipitate a seizure in a client with severe pregnancy-induced hypertension. Option A, true. Option B, false. The correct answer is option A, true. A quiet, darkened room is necessary to decrease stimuli and reduce the risk of convulsions. Question 4. A physician orders oxytocin for a client whose labor has slowed but the fetal head shows significant molding and is not progressing. The nurse should: Option A, begin the infusion as ordered. Option B, increase the dose every 15 minutes. Option C, maintain the dose once contractions are regular. Option D, question the order. The correct answer is option D, question the order. Oxytocin should not be used if there is a risk that the baby head is too large for the pelvis. Question 5. Using the Gravida Para system, a woman who is pregnant for the third time and had 2 prior deliveries after 20 weeks is: Option A, Gravida 3 Para 1. Option B, Gravida 3 Para 2. Option C, Gravida 2 Para 1. Option D, Gravida 2 Para 2. The correct answer is option B, Gravida 3 Para 2. Gravida refers to the number of pregnancies and para refers to the number of births after 20 weeks. Question 6. Which statement indicates a need for further teaching for a client with chronic lung disease? Option A, I need to eat high-calorie, high-protein foods. Option B, I will take vitamin supplements. Option C, I must eliminate all milk and milk products from my diet. Option D, I will eat small frequent meals. The correct answer is option C, I must eliminate all milk and milk products from my diet. Milk does not make mucus thicker and does not need to be eliminated, though rinsing the mouth after drinking it is helpful. Question 7. Which food choices help prevent constipation? Option A, eggs and hash browns. Option B, pancakes and syrup. Option C, bagel and cream cheese. Option D, oatmeal and half a grapefruit. The correct answer is option D, oatmeal and half a grapefruit. The combination of fiber from whole grains and fruit provides the bulk needed to prevent constipation. Question 8. When cleaning the site of a catheter, the nurse should: Option A, wipe toward the opening. Option B, wipe away from the opening. Option C, use talcum powder to stay dry. Option D, insert the catheter deeper after cleaning. The correct answer is option B, wipe away from the opening. Wiping away from the opening removes bacteria from the point of entry and reduces infection risk. Question 9. Symptoms of epiglottitis in a child include: Option A, croupy cough and low fever. Option B, inspiratory stridor and purulent secretions. Option C, drooling, agitation and absence of a cough. Option D, brassy cough and irritability. The correct answer is option C, drooling, agitation and absence of a cough. Epiglottitis has a rapid onset with high fever, drooling and a very quiet but distressed child. Question 10. A client with a history of urinary infections needs more teaching if she says: Option A, I will drink 8 ounces of cranberry juice daily. Option B, I will drink at least 2,000 milliliters of fluid. Option C, I will wash my hands before and after voiding. Option D, I will limit my fluids after 6 in the evening. The correct answer is option D, I will limit my fluids after 6 in the evening. Limiting fluids leads to concentrated urine and stagnation, which increases the risk of bacterial growth. Question 11. During a precipitous delivery, the nursing action is to: Option A, control the delivery by guiding the baby. Option B, leave to call the doctor. Option C, push against the perineum to stop it. Option D, cross the client legs. The correct answer is option A, control the delivery by guiding the baby. The nurse should stay with the client and guide the expulsion to prevent injury. Question 12. Nursing care for organic brain disorder should include, option A, a challenging education program, option B, an organized safe environment, option C, long extended family visits, option D, detailed complex explanations. The correct answer is option B, an organized safe environment. Safety and reorientation in a consistent environment are the priority goals. Question 13. A nursing intervention that reduces the risk of eye damage in a premature infant on oxygen is to, option A, maintain oxygen at less than 40%, option B, maintain oxygen at more than 40%, option C, give moist oxygen at high levels, option D, use 100% oxygen. The correct answer is option A, maintain oxygen at less than 40%. High levels of oxygen over a long period can cause blindness in premature infants. Question 14. A client with ketoacidosis has a pH of 7.2 and low bicarbonate. This represents, option A, respiratory alkalosis, option B, respiratory acidosis, option C, metabolic alkalosis, option D, metabolic acidosis. The correct answer is option D, metabolic acidosis. Low pH and low bicarbonate are the markers for metabolic acidosis. Question 15. The first nursing action for a client with severe anxiety who is crying hysterically is to, option A, demand she relax, option B, ask what the problem is, option C, stand or sit next to her, option D, give her a task to do. The correct answer is option C, stand or sit next to her. Being present conveys a message of caring and security when the client is too anxious to communicate. Question 16. A prima gravida in the second stage of labor will typically demonstrate, option A, a desire to push, option B, rapid breathing, option C, a desire to walk, option D, total relaxation. The correct answer is option A, a desire to push. The second stage is characterized by the urge to bear down and push. Question 17. The nurse should follow a model of intervention that approaches an out-of-control client on a continuum of least restrictive care. Option A, true, option B, false. The correct answer is option A, true. The nurse should start with verbal methods and move to medication or restraints only if necessary. Question 18. If a pregnant woman feels lightheaded and pale while lying on her back, the first intervention is to, option A, place her in Trendelenburg position, option B, check for vaginal bleeding, option C, obtain vital signs, option D, help her to a sitting or side-lying position. The correct answer is option D, help her to a sitting or side-lying position. Moving the woman off her back relieves the pressure on the major vein and fixes the low blood pressure. Question 19. The correct method for manual milk expression is to compress the breast at the outer border of the dark circle around the nipple. Option A, true, option B, false. The correct answer is option A, true. Positioning the fingers at the border of the areola and compressing is the best way to reach the milk sinuses. Question 20. An oxytocin infusion should be discontinued if contractions are, option A, 3 minutes apart, option B, 60 seconds in duration, option C, less than 2 minutes apart, option D, accompanied by a resting phase. The correct answer is option C, less than 2 minutes apart. Contractions that are too frequent can lead to fetal hypoxia and uterine rupture. Question 21. A volume control set is used for intravenous fluids in infants because it, option A, allows other drugs to be given, option B, prevents air from entering, option C, prevents accidental administration of large amounts of fluid, option D, prevents vein irritation. The correct answer is option C, prevents accidental administration of large amounts of fluid. This equipment allows the nurse to strictly control the exact amount of fluid the infant receives over time. Question 22. The first nursing action after a spontaneous rupture of membranes is to, option A, assess the mother breathing, option B, notify the physician, option C, auscultate the fetal heart rate, option D, transfer to the delivery room. The correct answer is option C, auscultate the fetal heart rate. The fetus is at risk for a prolapsed cord immediately after the water breaks. Question 23. A client with blindness that has no organic cause following a trauma is experiencing option A, delusion, option B, illusion, option C, hallucination, option D, conversion. The correct answer is option D, conversion. Conversion is the expression of mental conflict through physical symptoms. Question 24. A client with fractured ribs and a collapsed lung will demonstrate option A, crackles and paradoxical movement, option B, decreased breath sounds and chest pain with movement, option C, rhonky and frothy sputum, option D, wheezing and a dry cough. The correct answer is option B, decreased breath sounds and chest pain with movement. Decreased breath sounds occur when the lung is not fully inflated and rib fractures cause pain with every move. Question 25. The first nursing action for a partial thickness burn is to option A, apply ice packs, option B, remove all charred clothing, option C, apply silver sulfadiazine, option D, immerse the area in cool water. The correct answer is option D, immerse the area in cool water. Cool water permits a gradual temperature change and prevents further tissue damage. Ice is too extreme and can cause more injury. Question 26. The nurse should anticipate the administration of oxytocin to induce labor. Option A, true. Option B, false. The correct answer is option A, true. Oxytocin is the standard hormone used to produce strong uterine contractions for labor. Question 27. The transition stage of labor is characterized by option A, fatigue and chills, option B, perineal pain and a gush of blood, option C, irritability and the urge to vomit, option D, leg cramps and a perineal bulge. The correct answer is option C, irritability and the urge to vomit. Strong contractions and cervical dilation in transition often cause irritability and nausea. Question 28. If a bottle of potassium chloride reads 20 milliequivalents per 15 milliliters and the order is for 1.5 milliliters, the nurse should give option A, 1 milliequivalent, option B, 1.13 milliequivalents, option C, 2 milliequivalents, option D, 5 milliequivalents. The correct answer is option C, 2 milliequivalents. 15 milliliters divided by 20 equals 0.75. 1.5 milliliters contains 2 milliequivalents. Question 29. The first symptom that a client is hyperventilating during labor is option A, feeling cold, option B, a backache, option C, feeling dizzy, option D, nausea. The correct answer is option C, feeling dizzy. Dizziness is the first sign that the body is losing too much carbon dioxide. Question 30. On the second postpartum day, a large bruised area on the perineum should be treated with option A, exposure to air, option B, ice packs, option C, warm sitz baths, option D, immediate surgery. The correct answer is option C, warm sitz baths. Moist heat from sitz baths increases circulation and promotes healing after the initial 24 hours. Question 31. To assist an anorexic client who feels powerless, the nurse should option A, establish a structured environment with routine tasks, option B, distract the client during meals, option C, perform frequent room checks for hidden food, option D, discuss food in depth to encourage eating. The correct answer is option A, establish a structured environment with routine tasks. Structured environments offer safety and help the client develop internal control. Question 32. The primary goal of a preschool program for a child with Down syndrome is to option A, provide respite for the mother, option B, facilitate optimal development, option C, provide a demanding program, option D, prepare for mainstreaming. The correct answer is option B, facilitate optimal development. Every child, regardless of ability, deserves a program focused on reaching their optimal growth and development. Question 33. A nurse should feed an infant who has had a cleft lip repair using A, option A, gavage tube, option B, nipple and bottle, option C, straw and cup, option D, syringe. The correct answer is option D, syringe. A syringe allows formula to be placed in the back of the mouth, minimizing the suction that could damage the sutures. Question 34. Painless vaginal bleeding in the last trimester is often caused by option A, menstruation, option B, detached placenta, option C, placenta previa, option D, excessive fluid. The correct answer is option C, placenta previa. A low-lying placenta that separates as the cervix dilates causes painless bleeding. Question 35. Arterial blood gases showing a normal pH with high carbon dioxide and high bicarbonate represent: option A, compensated metabolic acidosis, option B, compensated respiratory acidosis, option C, compensated respiratory alkalosis, option D, uncompensated respiratory acidosis. The correct answer is option B, compensated respiratory acidosis. When the pH is normal but the other values are high, it indicates the kidneys have compensated for a lung problem. Question 36. Which preoperative order for a cesarean delivery should a nurse question? Option A, Demerol 100 mg intramuscularly 1 hour before delivery. Option B, discontinue the oxytocin infusion. Option C, insert a Foley catheter. Option D, prepare the abdominal area. The correct answer is option A, Demerol 100 mg intramuscularly 1 hour before delivery. Narcotics cross the placenta and can cause respiratory depression in the newborn. Question 37. An appropriate response to a client learning to self-catheterize who says it is too much trouble is: option A, I know it is a lot to learn but it will reduce infections in the long run. Option B, it is not too much trouble and you must do it. Option C, I will ask the doctor to use a permanent tube instead. Option D, you have to learn this because it was ordered. The correct answer is option A, I know it is a lot to learn but it will reduce infections in the long run. This response acknowledges feelings while providing factual information about the benefits. Question 38. Hallucinations in a schizophrenic client fall into the category of: option A, impaired communication, option B, sensory perceptual alterations, option C, altered thought processes, option D, impaired social interaction. The correct answer is option B, sensory perceptual alterations. A hallucination is a false sensory perception not associated with real external stimuli. Question 39. Using Nagili rule, if a last menstrual period begin June 10th, the estimated date of delivery is: option A, March 17th, option B, June 3rd, option C, August 30th, option D, January 10th. The correct answer is option A, March 17th. Subtract 3 months from June and add 7 days to the 10th. Question 40. The most reliable way to confirm the placement of a small bore feeding tube is: option A, aspirate gastric contents, option B, listen for air in the stomach, option C, obtain a chest X-ray, option D, observe for bubbles in water. The correct answer is option C, obtain a chest X-ray. An X-ray is the only definitive way to ensure the tube is in the stomach and not the lungs. Question 41. Which exercise can a client begin within a few days after a vaginal delivery? Option A, push-ups, option B, jumping jacks, option C, leg lifts, option D, Kegel exercises. The correct answer is option D, Kegel exercises. Kegels stimulate muscle tone in the perineal area and are safe for early postpartum. Question 42. During an echocardiogram, the client must: option A, ride a stationary bicycle, option B, lie still while cool gel is applied to the chest, option C, be sedated by a physician, option D, take medication to become sleepy. The correct answer is option B, lie still while cool gel is applied to the chest. An echocardiogram is a non-invasive ultrasound that requires the client to remain still. Question 43. To relieve pain from a bleeding joint in a hemophiliac, the nurse should: option A, place the child on bed rest and splint the knee, option B, apply moist heat, option C, administer aspirin, option D, encourage active movement. The correct answer is option A, place the child on bed rest and splint the knee. Immobilization and rest reduce the bleeding, which in turn relieves the pain. Question 44. A client who protests "I am God" is experiencing a: option A, delusion, option B, illusion, option C, hallucination, option D, conversion. The correct answer is option A, delusion. A delusion is a fixed false belief. Question 45. A potential life-threatening complication for a client with a spinal cord injury is: option A, autonomic dysreflexia, option B, slow heart rate, option C, central cord syndrome, option D, spinal shock. The correct answer is option A, autonomic dysreflexia. This condition causes uncontrolled high blood pressure which can lead to a stroke or heart attack. Question 46. If a physician orders 50 milliliters per hour and the nurse uses microdrip tubing, the rate should be option A, 1 drop per minute, option B, 5 drops per minute, option C, 50 drops per minute, option D, 100 drops per minute. The correct answer is option C, 50 drops per minute. With microdrip tubing, 1 milliliter equals 60 drops, so the rate in drops per minute is the same as milliliters per hour. Question 47. A weight gain of 2 pounds in 24 hours in a heart failure client may indicate option A, a diet high in calories, option B, decreasing cardiac output, option C, decreasing kidney function, option D, diabetes insipidus. The correct answer is option B, decreasing cardiac output. Decreased heart function leads to fluid retention, which is reflected by rapid weight gain. Question 48. The most serious side effect of a monoamine oxidase inhibitor when combined with aged foods is option A, hypertensive crisis, option B, severe rash, option C, severe low blood pressure, option D, severe diarrhea. The correct answer is option A, hypertensive crisis. Tyramine in aged foods can provoke a life-threatening spike in blood pressure. Question 49. Which of the following is an appropriate goal for a passive-aggressive client? Option A, allow the client to use sarcasm. Option B, allow the client to express anger using iMessages. Option C, give the client time away from responsibilities. Option D, accept excuses for forgotten tasks. The correct answer is option B, allow the client to express anger using iMessages. Using iMessages is a healthy, assertive way to express anger directly rather than through passive behavior. Question 50. A newborn with tremors and a poor sucking reflex whose mother is diabetic likely has option A, nerve damage, option B, low blood sugar, option C, high blood sugar, option D, normal responses. The correct answer is option B, low blood sugar. The infant pancreas produces too much insulin in response to the mother high sugar levels, leading to a crash after birth. Question 51. A client who thinks they are a messenger from another planet who can rule the earth is having option A, ideas of reference, option B, delusions of persecution, option C, thought broadcasting, option D, delusions of grandeur. The correct answer is option D, delusions of grandeur. Delusions of grandeur involve thinking one is omnipotent or has superhuman powers. Question 52. The earliest clinical sign of respiratory distress in a newborn is option A, blue skin, option B, increased breathing rate, option C, chest retractions, option D, decreased breathing rate. The correct answer is option C, chest retractions. The use of accessory muscles to breathe, seen as retractions, is the first sign of struggle. Question 53. Before a newborn is moved from the delivery room to the nursery, the nurse must ensure option A, the physician verifies the time, option B, sponges are counted, option C, prophylactic ointment is given, option D, the mother and baby have identical identification bands. The correct answer is option D, the mother and baby have identical identification bands. Matching bands are the primary method for ensuring the baby is correctly identified with the mother. Question 54. The best response to a delusional client who says people are surrounding my house to use my body for science is option A, describe the people to me, option B, why do you think they want your body, option C, no one is surrounding your house and you are safe, option D, I know that must be frightening and let us know if you have more troubling thoughts. The correct answer is option D, I know that must be frightening and let us know if you have more troubling thoughts. Focusing on the feeling reinforces reality and discourages the false belief without a direct confrontation. Question 55. The most appropriate position for a client in pulmonary edema is option A, high Fowler, option B, lying on the left side, option C, sitting in a chair, option D, supine with feet up. The correct answer is option A, high Fowler. The high Fowler position decreases blood return to the heart and allows for maximum lung expansion. Question 56. A client who becomes dependent and demanding during a cancer diagnosis is using which defense mechanism? Option A, denial, option B, displacement, option C, regression, option D, projection. The correct answer is option C, regression. Regression is returning to an earlier stage of development during times of stress. Question 57. A client 3 days after a heart attack who has crackles in the lungs and shortness of breath is developing, option A, another heart attack, option B, pneumonia, option C, pulmonary edema, option D, pulmonary emboli. The correct answer is option C, pulmonary edema. Left ventricular failure after a heart attack often leads to fluid in the lungs known as pulmonary edema. Question 58. Arterial blood gases with a low pH and high carbon dioxide and normal bicarbonate reflect. Option A, compensated respiratory acidosis. Option B, normal gases. Option C, uncompensated metabolic acidosis. Option D, uncompensated respiratory acidosis. The correct answer is option D, uncompensated respiratory acidosis. The low pH and high carbon dioxide show the body has not yet had time to compensate for the respiratory failure. Question 59. A newborn with a sac on the back from a spinal defect should be positioned. Option A, prone on the stomach. Option B, supine on the back. Option C, side-lying. Option D, in a semi-sitting position. The correct answer is option A, prone on the stomach. The prone position prevents pressure and trauma to the sac. Question 60. The most critical component of APGAR scoring is option A, pupil response. Option B, respiratory rate. Option C, heart rate. Option D, reflexes. The correct answer is option C, heart rate. Heart rate is the most vital sign assessed during the APGAR score. Question 61. If a last menstrual period began August 3rd, the estimated date of delivery is option A, November 7th. Option B, November 10th. Option C, May 7th. Option D, May 10th. The correct answer is option D, May 10th. Subtract 3 months from August and add 7 days to the third. Question 62. Symptoms of theophylline toxicity include option A, palpitations and restlessness. Option B, slow heart rate. Option C, stomach pain. Option D, increased appetite. The correct answer is option A, palpitations and restlessness. Restlessness and a racing heart are classic signs that the drug level is too high. Question 63. Which type of insulin can be administered by a continuous intravenous drip? Option A, Humulin N. Option B, NPH. Option C, regular. Option D, Lente. The correct answer is option C, regular. Regular insulin is the only form that can be given intravenously. Question 64. A mother in the taking hold phase of postpartum will, option A, be concerned about her own recovery. Option B, call the infant by name. Option C, touch the infant only lightly. Option D, be concerned about her weight. The correct answer is option B, call the infant by name. In this phase, the mother becomes actively involved with the infant and begins to bond more deeply. Question 65. Before a coronary arteriography, the client should be taught that option A, he can walk to the bathroom. Option B, he will be kept without food for 24 hours. Option C, bleeding at the site is normal. Option D, the leg used must be kept straight for 8 to 12 hours. The correct answer is option D, the leg used must be kept straight for 8 to 12 hours. Keeping the leg straight prevents the risk of severe bleeding from the puncture site. Question 66. The primary nursing goal for a newborn of a diabetic mother is option A, bonding. Option B, maintain normal blood sugar. Option C, maintain normal nutrition. Option D, monitor output. The correct answer is option B, maintain normal blood sugar. The infant is at very high risk for a blood sugar crash due to excess insulin production. Question 67. Following a saline abortion, the nurse should be alert for which early side effect? Option A, water satiety. Option B, thirst. Option C, edema. Option D, diabetes. The correct answer is option B, thirst. Absorption of the saline into the blood increases sodium and the desire for water. Question 68. Myocardial contractility in a heart failure client can be improved by administering option A, digoxin. Option B, furosemide. Option C, oxygen. Option D, nitroglycerin. The correct answer is option A, digoxin. Digoxin is a cardiac glycoside that strengthens the heart contraction. Question 69. In the immediate period after a shunt placement for hydrocephalus, the client should be positioned. Option A, head up on the non-operative side. Option B, head up on the operative side. Option C, bed flat on the operative side. Option D, bed flat on the non-operative side. The correct answer is option D, bed flat on the non-operative side. The flat position prevents a rapid drop in brain fluid and the non-operative side prevents pressure on the valve. Question 70. Anemia in the first trimester is often a result of: Option A, the mother increased blood volume. Option B, the mother decreased blood volume. Option C, the fetus increased blood volume. Option D, increased iron absorption. The correct answer is option A, the mother increased blood volume. The mother blood volume increases faster than the red cells can be made, leading to a diluted anemia. Question 71. A trauma client with rib fractures who develops bloody sputum and patchy lung infiltrates after 24 hours has: Option A, pneumonia. Option B, pulmonary contusions. Option C, pulmonary edema. Option D, tension pneumothorax. The correct answer is option B, pulmonary contusions. Blood trauma causes bruising and bleeding into the lung tissue known as contusions. Question 72. A client receiving intravenous retidrine for premature labor should be observed for: Option A, low blood sugar. Option B, high potassium. Option C, rapid heart rate. Option D, increased hematocrit. The correct answer is option C, rapid heart rate. Retidrine is a stimulant that commonly causes a rapid heart rate and low blood pressure. Question 73. Following a vaginal delivery, the nurse should primarily observe for: Option A, difficult labor. Option B, Chadwick sign. Option C, fatigue and hemorrhoids. Option D, hemorrhage and infection. The correct answer is option D, hemorrhage and infection. These are the most common and serious immediate complications after birth. Question 74. If a bottle is labeled 10 mg per milliliter and the order is for 0.5 milliliters, the nurse should give: Option A, 5 mg. Option B, 0.5 mg. Option C, 0.05 mg. Option D, 20 mg. The correct answer is option A, 5 mg. 0.5 times 10 equals 5 mg. Question 75. A 60% hematocrit in an infant with a heart defect may indicate: Option A, normal levels. Option B, infection. Option C, polycythemia. Option D, slow clotting time. The correct answer is option C, polycythemia. A high red cell count is a common complication as the body tries to compensate for low oxygen. Question 76. Prior to surgical closure of a spinal sac, the nurse should: Option A, cover it with a dry dressing. Option B, cover it with a saline-soaked sterile dressing. Option C, keep it open to the air. Option D, aspirate the fluid. The correct answer is option B, cover it with a saline-soaked sterile dressing. A moist sterile dressing prevents the tissue from drying out or becoming contaminated. Question 77. The Trendelenburg position is used during central line insertion to: Option A, help the doctor see the vein. Option B, reduce the possibility of an air embolism. Option C, reduce bruising. Option D, make the client comfortable. The correct answer is option B, reduce the possibility of an air embolism. This position places positive pressure on the veins so air cannot enter the bloodstream. Question 78. The purpose of a water seal in a chest tube system is to: Option A, prevent air from entering the pleural space. Option B, prevent fluid from entering. Option C, measure drainage. Option D, indicate breathing effort. The correct answer is option A, prevent air from entering the pleural space. The water acts as a one-way valve, allowing air out of the chest but not back in. Question 79. The first symptom of increased brain pressure in a 3-year-old is: Option A, bulging soft spot. Option B, seizure. Option C, headache. Option D, loss of coordination. The correct answer is option C, headache. Headache is an early and significant sign in children who are old enough to communicate it. Question 80. A common side effect of the anesthetic bupivacaine during an epidural is: Option A, high blood pressure. Option B, low blood pressure. Option C, low blood sugar. Option D, high blood sugar. The correct answer is option B, low blood pressure. The drug causes blood vessels to relax, which leads to a drop in maternal blood pressure. Question 81. The purpose of a cerclage procedure at 16 weeks is to: Option A, reinforce a weak cervix. Option B, repair the amniotic sac. Option C, evaluate the pelvis. Option D, dilate the cervix. The correct answer is option A, reinforce a weak cervix. The procedure uses sutures to hold the cervix closed when it is too weak to support a pregnancy. Question 82. What does salt have to do with high blood pressure? Option A, the reason is unknown. Option B, large amounts of salt cause you to retain fluid, which increases pressure. Option C, salt damages the blood vessels directly. Option D, salt is needed to lower pressure. The correct answer is option B, large amounts of salt cause you to retain fluid, which increases pressure. Decreasing salt reduces the fluid the heart has to pump, which lowers the pressure. Question 83. Which immunization is the priority for a burn victim? Option A, polio. Option B, hepatitis B. Option C, tetanus toxoid. Option D, flu. The correct answer is option C, tetanus toxoid. Tetanus is a serious risk for any contaminated wound, including burns. Question 84. If 1000 milliliters is to be infused in 8 hours with a drop factor of 60, the rate is: Option A, 75 drops per minute. Option B, 100 drops per minute. Option C, 125 drops per minute. Option D, 150 drops per minute. The correct answer is option C, 125 drops per minute. 1000 divided by 8 is 125 milliliters per hour. With a 60 drop set, the rate is the same. Question 85. The expected expression of a schizophrenic client is: Option A, anger. Option B, apathy and flatness. Option C, smiling. Option D, hostility. The correct answer is option B, apathy and flatness. A lack of emotional response known as a flat affect is characteristic of the disorder. Question 86. Effectiveness of benztropine therapy is indicated by: Option A, smooth coordinated movement. Option B, tremors. Option C, muscle stiffness. Option D, muscle weakness. The correct answer is option A, smooth coordinated movement. The drug is given to reduce the tremors and stiffness caused by other medications. Question 87. After using a steroid inhaler, the client should: Option A, clean the inhaler with bleach. Option B, drink a glass of water or gargle. Option C, sit and rest for an hour. Option D, use a bronchodilator immediately. The correct answer is option B, drink a glass of water or gargle. Rinsing prevents the development of oral yeast infections, which are a side effect of steroids. Question 88. The greatest risk to a baby born before 37 weeks is: Option A, high blood sugar. Option B, low blood sugar. Option C, incomplete intestines. Option D, incomplete lung development. The correct answer is option D, incomplete lung development. Premature babies often lack enough surfactant to keep their lungs from collapsing. Question 89. A strategy for an Alzheimer client who is agitated in new situations is: Option A, maintain routines and adhere to schedules. Option B, force the client to attend all activities. Option C, change the way questions are asked frequently. Option D, give many choices at once. The correct answer is option A, maintain routines and adhere to schedules. Consistency and structure help support orientation and reduce frustration. Question 90. A fetus in a posterior position will likely: Option A, decrease the total labor time. Option B, prolong the first stage of labor. Option C, decrease the time of the first stage. Option D, prolong the third stage. The correct answer is option B, prolong the first stage of labor. The larger diameter of the head takes longer to move through the pelvis in this position. Question 91. The best position for assessing the perineum after a delivery is: Option A, side lying. Option B, sitting. Option C, face down. Option D, on the back. The correct answer is option A, side lying. The Sims position allows the nurse to fully see the area by raising the upper buttock. Question 92. A client with a prolapsed cord should be placed in which position? Option A, reverse Trendelenburg. Option B, Fowler sitting. Option C, Trendelenburg head down. Option D, Sims. The correct answer is option C, Trendelenburg head down. Head down position moves the fetus away from the cord to restore blood flow. Question 93. Infants delivered by cesarean section are at higher risk for option A, cold stress, option B, cyanosis, option C, respiratory distress syndrome, option D, seizures. The correct answer is option C, respiratory distress syndrome. Because they do not pass through the birth canal, the fluid is not squeezed out of their lungs. Question 94. The safest antibiotic for a pregnant client with a kidney infection is option A, oxytocin, option B, magnesium sulfate, option C, ampicillin, option D, tetracycline. The correct answer is option C, ampicillin. Ampicillin has no known harmful effects on the fetus, while tetracycline can stain teeth. Question 95. The appropriate nursing action for a child with high brain pressure is option A, keep the head of the bed at 45 degrees in a neutral position, option B, keep the child flat, option C, turn the head to the side, option D, increase visitation for stimulation. The correct answer is option A, keep the head of the bed at 45 degrees in a neutral position. Elevation and a neutral position promote the drainage of brain fluid.